Hey there, this is Dawn with the Life with Old Dogs podcast, and I am here this week with Donna Challender. Sorry, I hope I got that right. Challender. And she is from UCB, that is the Upright Canine Brigade. And Donna is here to talk with us about Megaesophagus. That is one of the top 20 health issues in senior German Shepherds that we are covering in this season. So, Donna, welcome and thank you for being here with us.
Oh, Dawn, thank you so much for having me. I really appreciate the chance to spread awareness on Megaesophagus. And it's like a big word, like snuffleupagus,
Yes, it is. It is. In
but
fact, in my
but it's, yeah,
my notes here, I just have ME.
yeah, right, right. Or mega E. There's a lot of different abbreviations. But yeah, if you take it apart, it's mega, which is huge, esophagus, which is the tube that runs from the mouth to the stomach, where the dog would get their food and water. And there's several reasons why the dog's esophagus is enlarged. The muscles are not working, for one, and so it's not pushing the food and the water down to the stomach. And what happens is they regurgitate their food because the muscles are not working, and it's different than vomiting. Okay, when they regurgitate, it's more like the food just kind of spills out, and it's generally quiet. There could be some little bit of noise, but it's generally quiet, unlike vomiting. So, and if we've all seen our dogs vomit, and that's they'll circle, they'll look sick, they'll look ill, they'll retch, and their stomach will contort, and so there's a big difference between regurgitation and vomiting.
Mhm.
And that's like a major problem, because a lot of people will go into their vets when this is happening, and they'll say, oh, my dog is spitting up, or my dog is vomiting, and the vet will then look at different issues. They'll think there's a blockage, or it's a food allergy, and sometimes the dog is not diagnosed properly until they get a aspiration pneumonia, that's when food and water is ingested into the lungs, and it causes pneumonia. And then they'll take the X-ray, and then they'll see it. They'll see the big, large esophagus.
Okay, so that is visible through an X-ray, is what you're
It
saying.
is. It is visible as long as they're looking for it. And one with a barium or a barium swallow study actually will highlight it so that they can pick it out easier and see it easier. And so that is basically the hallmark sign of Megaesophagus is regurgitation. They also may be underweight because they're not getting the nutrients that they need to grow. So there are two types. There are two types of, there is congenital idiopathic megaesophagus, or CIM. That's when the puppy is born with this disease. And when that happens, the first thing that they should rule out is a persistent right aortic arch, PRAA.
Okay.
And what that is a vessel that should have dissolved before the fetus was born remains to strangle off the esophagus.
Oh.
And yeah.
So it doesn't disintegrate. Why would it not do that? Do you know why?
It's just a birth defect. Nobody really knows why.
Okay.
But there's surgery for that. And once that they go in there and they cut that band and release the esophagus, sometimes the dog or the puppy will no longer have megaesophagus, and they'll be able to eat normally after that. Other times it could remain, and they won't have as much trouble eating because the esophagus is released.
Okay, so even after the surgery, there still could be issues. So it's not a guaranteed fix.
It isn't a guarantee fix, but it makes it much, much more easier to manage.
Okay.
As you can imagine, something that is restricting the esophagus like that, the puppy may choke if
Hmm.
they get into something that they can't handle. They could pass out, and it's very serious. And it's recommended that the surgery be done.
Okay.
Um, can be expensive,
Yeah, I
however.
was thinking that. Yeah, well, it never is cheap, right?
Right, it's
No
never
matter
cheap.
what.
No,
So,
but
but
it's well
if it's going to give the dog quality of life, it sounds like
correct.
it's well worth it.
It is, it certainly is, yeah,
Okay.
and,
So you said there were two
2
kinds.
types, yes.
What was the
So
other type?
it's acquired, Megaesophagus, and, it can be acquired through another disease.
Oh, okay.
The top culprit is Myasthenia gravis, which is a neuromuscular autoimmune disease, and, that usually comes on very suddenly. They may all of a sudden start to regurgitate their food, or they may have trouble walking. So it does attack the striated muscles in the dog, and the esophagus is made up of all striated muscles. That's usually why they have megaesophagus with it. Sometimes they do have the weakness in the hind legs as well. And it's usually after some sort of exercise. It's not like when they get up or anything like that. It's more like they're walking and all of a sudden their back legs look like stilts,
Okay.
and they're very stiff. And then they'll either sit down suddenly, or they'll just collapse.
Oh,
And yeah, so it usually starts with megaesophagus and then moves over to the hind end area, but not always. Sometimes there's something called focal myasthenia gravis, and that usually involves just the esophagus and the head area, and they don't have the hind leg weakness. So there is a blood test. It's a special blood test that they would take, and it goes to California. And only one lab tests for this in the whole entire world.
oh my goodness.
It's
Wow.
crazy, right?
Yeah. Yeah, you would think more would be on board at this point because Megaesophagus is not new.
Yeah, it's very controlled.
Mhm.
And if they test positive, they can receive treatment, and the treatment is mestinon or pyridostigmine, and it's a miracle drug for MG. This is what humans take when they have myasthenia gravis, and it works for doggies and kitty cats too.
Oh,
So
that's wonderful. Really, that's
uh,
wonderful. So you're saying, that treatment, so once they're treated for it, the Megaesophagus goes away?
sometimes
Sometimes,
that's the
okay.
wonderful thing. That's why we always say best to test.
Right, best to test,
Yes,
okay.
yeah.
So then there's two other, underlying reasons why a dog could end up with Megaesophagus. What
Yeah.
would they be?
Hypothyroidism, which that's very common in
Yeah.
dogs.
Yes.
So that can also cause that kind of weakness. And again, it's a blood test and it can be treated. A full panel is usually recommended, or T3 and T4
Mhm.
to thoroughly test it. But again, it can be treated with medicine, and sometimes after it's treated, the megaesophagus can resolve. So there's hope with that. And Addison disease,
Mhm.
same thing. So we see those three culprits in our group quite often, along with a lot of other different neurological diseases that can cause it as well. But those three are the top three. Laryngeal paralysis, also, we see that quite a bit,
Hmm.
um, and which you probably have seen that in with the German Shepherds too, because that usually goes along with the larger breeds,
Yes.
older, larger breeds.
Right,
Yeah.
yeah. Mhm.
So
Yes. Okay, so, all right. Then okay, so then you were talking also about, in the notes here that I have about narrowing in the esophagus and
mhm,
a, um, procedure they can perform. Can you tell us
mhm.
about that?
Yeah, sometimes there's a stricture or a narrowing in the esophagus. It could be scar tissue. It could be caused from esophagitis, having acid reflux come up so much, and it
Mhm.
just causes a narrowing in the esophagus. And they can go in and do balloon dilations and open up that stricture. Sometimes it takes 3 or 4 of them to thoroughly open it up and keep it open.
Okay.
But that's definitely a surgery that they can do with the endoscopy. It's just they just put that little tube down there with the camera and and then they inflate that balloon and just open up that stricture. So that's also something that can be helped with megaesophagus if it's there.
Wow.
Fluoroscopy is a great way to test to see what's going on inside. It's like a real live video
Mhm.
of a dog eating and how the food it goes down. It's really fascinating.
It sounds fascinating.
It
So
is
I'm just curious though, how does this work? I mean, is the dog under anesthesia? It can't be under
not
anesthesia and eating at the same time. So
correct.
how does that work?
Correct. Yes. Actually, I think the best way it's done is Dr. Jillian Haynes does one with the dog sitting in a Bailey chair. And she has it set up so she can actually video the dog eating while it's sitting up in the Bailey chair. And some of her some of her testing is just wonderful. So she can determine not only if there's a stricture or PRA or anything like that, but she can also determine what kind of food your Megaesophagus dog does best with. Like
Okay.
some dogs do better with a meatball, a small meatball that was dropped from above their head,
Hmm.
one at a time, and so that it's not chewed. We don't want it to be chewed. So you want them to swallow it whole. And some do better with a slurry, just a very watery, canned food mixed with water. And then other times they do better with like a milkshake consistency or a oatmeal consistency. And she can test for all these different things and tell you what the dog is going to do best with by looking at it through the she has a screen and everything up there, and she'll show you this is your dog, this is what's happening on the inside of your dog. It's fascinating,
So
absolutely fascinating.
this is Dr. Jillian Hayes. Is that what you said her name was?
Haynes,
Hayes.
Haines, yes, from WSU, Washington State University. She is amazing.
Okay. I'm going to include her information in the show notes here. That way, if anybody wants to look her up, they can see her videos.
Oh
Is
yeah, oh
that
yeah,
so? Because it sounds like she would be a wonderful resource to add for our
oh
show
yes,
notes for people who would like
absolutely.
to actually see how this is done. I know I'm going to go look. I want
Yeah,
to see.
you
I want to see how
definitely.
this is done.
I- If you go to our website and you look under the research tab, you'll see all of Jillian's work.
Okay,
Uh,
great.
and she's wrote several different articles about Megaesophagus and has studied it inside and out. And she's just wonderful.
Okay,
So
that's awesome. So it's right on your website, and if anybody
yes,
wants to go see it, they just go to the research tab you said, and you can look up Dr. Jillian Haynes that
she's the
way.
first one there.
Awesome. That's great. That's great. So let's back up here a little bit. So you touched base a little bit on the symptoms, but again, can you clarify what the symptoms of mega esophagus are?
Well, regurgitation
Okay.
and
Not vomiting.
not vomiting,
Right. Okay.
correct.
Mhm.
And also, they may be the runt of the litter sometimes because they're just underweight and malnutrition. If it goes on too long, they can suffer from malnutrition. So
Mhm.
this is why you asked me about the prognosis of megaesophagus, and I'll have to say it's good if it is discovered early and
Mhm.
it's treated and it's managed well. If
Mhm.
those 3 things are in place, the dog can live out a very good life.
Mhm.
And it's sad because in our group we'll get most of the members will come on and they're pretty shook up when they get the diagnosis. Sometimes they're told that the dog is not going to live long, or the dog is going to get aspiration pneumonia over and over and over again. And of course, there are some cases that are severe, and that is true, but I wouldn't say the vast majority of cases are like that. In fact, there's a lot of cases where the dog never gets aspiration pneumonia and is pretty well the entire time. So
Now, would you say that's a result of the dog's owner having a ton of information and knowing how to handle it, like you were talking about feeding the dog and
mhm.
wetting the food or making a slurry or dropping a meatball? Would you say that those people are able to figure out which way to feed the dog best suits their dog, and that's why they have more success, or no?
Yes, and feeding upright in what they call a Bailey chair is very
Yeah.
important.
Could you explain a
Um,
Bailey chair, please?
mhm. The Bailey chair, the dog will sit in the chair with his paws up, and it is like a little high chair, is what it is. And it's either a paw bar across or an actual door and a tray, or just a door. There's definitely different ways you can make a Bailey chair, but the point is it's allowing gravity to do the work that the muscles in the esophagus can't do anymore. So when you feed them upright and you leave them upright after meals so the gravity can continue to do its work, you want it to make sure it gets to the stomach before you release them from the chair. Then once it's in the stomach and it's onto the intestines and everything, they're fine. They're fine. They're like a normal dog. They go, they play, they're fine. But it's essential to feed them upright as best you can. There's times when with an older dog and they're very
Yeah.
arthritic, that it sitting in the chair is just not for them. So there are other alternatives. You can put them up on the couch and prop them up, or over the back of the couch. You can. There's just so many ways. You can take in a recliner and sit them in the recliner backwards, and then tilt it up,
Hmm.
or tilt it back so that they're inclined. They're not like totally inclined, but they're inclined.
Inclined enough.
That some of them can work it out that way.
Oh, that's
So
interesting.
yeah, oh yeah. Oh, the
That's
people are so resourceful. Like with the little ones, I mean, I've seen tidy cat canisters that people have made Bailey chairs. They've made them out of boxes. They've you know,
that is fantastic.
yeah,
And with, social media being what it is now, we can share it
and
and help
that's what it
others.
is.
So I'm curious, 2 things.
Okay.
Why is a Bailey chair called a Bailey chair?
That was discovered from a dog named Bailey back decades ago. And this family was struggling with their dog, and they just came up with this idea, and that's how it all started.
And it
Uh,
worked.
yep, and it
Awesome.
definitely worked. Yep, and caught
Okay.
on.
That's great. Really, it
Yeah,
is. And now you said they need to be in the chair. They sit in the chair so gravity does its job and pulls the food down into their stomach and
correct.
intestines. Now, how long do they have to stay in the chair?
Well, it depends. Like everything else, each dog is a little different. Some only need like 10 minutes, and then others may have to sit for 30 minutes or more.
Oh,
Yeah, but there's other drugs that can help with that too. I mean, sometimes it's a case of low motility and in the stomach, and so they'll put them on drugs that are pro motility drugs, like metoclopramide and cisapride.
mhm.
Those are the two major ones, and that helps move the food out of the stomach faster to make room for the next meal. So that those drugs are used, the pro motility drugs, and then there's also sildenafil, which you may have seen some stuff online because actually it was Jillian's report, Dr. Haynes' report, that she that hit hit the whole social media network. I know our group has had this report reposted about 50 times.
Yep.
And so sildenafil is Viagra, and it's used in veterinarian cases of um, pulmonary hypertension. But it they came across it, and it seems that it relaxes the lower esophageal sphincter that goes into the stomach, and it allows the food and water to go into the stomach easier. So sometimes that LES, they call it, is a big problem for dogs with megaesophagus. It's like a sticky gate, like it needs oil.
Mm-hmm.
And a lot of dogs have been helped with this drug. So they'll give it to them a couple of times a day before meals, and it allows that LES to relax, and
Okay.
that's really worked out well. And then
Yeah.
other dogs need like an antacid, like a Meprazole or Pepsid, or something along those lines. And the vet will prescribe that for acid reflux. And then there's, sometimes they'll have trouble with esophagitis, or
Mm-hmm.
like a very sore throat. In other
Mm-hmm.
words, so they'll get ulcers in the throat and things like that.
Oh,
So
that's got
yeah,
to be really uncomfortable.
it
Yeah.
is, and
Yeah.
so they'll use a drug called sulcrafate or carafate to soothe the esophagus,
Mhm.
and that usually works very well to clear up an ulcer. It like puts a protective Band-Aid on the esophagus so it can heal.
Right.
So,
I do have a question about the diet. Is there any foods that they shouldn't have that could make the mega esophagus worse?
well, I my whole motto is the best food for an ME dog is a food that goes down and stays down.
Okay.
so so we don't really recommend a specific. The only thing I can say is some people will try to give their dog cook up rice, and
Mhm.
rice will stick in the esophagus. I mean, it'll just keep on coming up, and
Mm.
so anything that's sticky like that doesn't work well.
Okay,
Um,
so maybe starchy foods. No starchy foods. Is that what you're
yeah,
saying? Okay.
right. It's things that will stick around. We don't want that.
Right, right. I was thinking along the lines of anything acidic because you're talking about acid reflux. So,
Hmm.
like we have Atticus. He's here. He's 12 years old, and just recently he started having some issues with acid reflux that he never had before. And basically, it comes down to the type of duck I'm feeding him, and I don't know. It's just whatever's in there. It's pretty fatty, and it's been bothering him. So I started thinking, well, if you have a mega esophagus dog, maybe they should not have foods that, cause um,
Hmm.
acid reflux. You don't want
Yeah,
to, make the problem worse.
right. Well, we see a lot of pancreatitis too in the group with some of the dogs are older, and of course that's from fatty foods and things like
Mhm.
that. So,
Right.
because we all want to fatten our dogs up when they've got this disease, and
Mhm.
but you have to be careful that you don't introduce too many fats into the diet, or else it'll cause other issues. So.
Absolutely,
Mhm.
absolutely, yeah. I just want to back up here because I was reading the notes, and you were talking about the food and how to play with the consistency to see what works for your dog. Meatballs, adding water to it, consistency like oatmeal, and then it says pet parents add thick into
Okay.
water to make thick it into water to make Knox blocks. What is that?
So a lot of times Emmy dogs have trouble with just plain water. It's like a tickle in the throat. It doesn't go down and it comes back up, and they just have a really hard time. Some dogs will drink their water before or after a meal while they're upright, and they do okay. But it's just such an individual disease, and so sometimes they cannot have just plain water. So what is suggested and what works for some dogs is thicket, and that is found in the drugstore. It's something that people use that have swallowing disorders because they have the same issues. So you add that powder, that thicket, to the water to make it thicken it up, and uh, I don't know what consistency it would be, but it does thicken it up, and it just they're able to drink it, and they don't seem to mind it so much. Like my dad had to do that because
Yeah.
he was very similar to the dogs. He had a stroke, and a major stroke, and he had trouble swallowing his food. And he went the same way as the dogs a lot of times. He went from, not being able, he had to do the thicket in his coffee and
Wow.
then
Huh.
pureed food. And,
Mhm.
and finally he ended up with a feeding tube.
Mm.
But, he bought that feeding tube for so long,
Yeah, well, who could blame him? You know,
Well,
so
except that he was miserable.
mhm,
And this is the story I tell a lot of times in the group is, we don't really know how our dogs feel about all this, and when they're
exactly.
struggling so bad that, they're just upchucking all the time like that. And they just don't feel good anymore. And
Right.
that's where my dad was. And so after he got the tube, because the GI doctor said, if you don't get the tube, Jim, you're going to die the next time you come in here with aspiration pneumonia. I mean, because
Mhm.
he got the same thing the dogs had.
Oh.
And he said, okay, I'll get the tube. And I asked him, I said, well, what's it like, Dad? Because we have this in group, this discussion in the group a lot, about the dogs. He says, I'm never hungry.
Hmm.
I'm never hungry. I don't choke anymore. And I was so tired of choking on my food.
Yeah.
And I,
And
and
the fear he must have felt choking on his food.
oh, it was terrible. We'd be in a restaurant and he'd be purple.
Oh,
And
that's terrible.
he wasn't enjoying eating anymore.
No. Well,
So,
no, because he thought he could choke to death while he was trying to eat. Who could blame him? But you're
no,
right. These dogs, they can't voice how they're feeling. I mean, I have nothing, no problem swallowing, but we have had several dogs here with Lyme disease.
mm,
We're here in the Poconos, the northeastern PA, so Lyme disease central. And I've since had Lyme disease twice, and of course, it was treatment with doxycycline. The same thing as the dogs. Well,
mm,
it no pun intended, it made me sicker than a dog. Just that
yes,
medication, and I started then thinking to myself, "My goodness, I'm giving this to our residents here from time to time. How are they feeling? Are they affected like the same way? And they can't even tell me this is how they're feeling. It was
right,
a real eye opener. It really was. And even with Atticus now with the acid reflux, many of us have had that for one reason
right.
or another at some
The
point in
GERD,
time.
yeah,
Yeah, and it's not an enjoyable experience.
no,
So you want to treat it as quickly as you can, number one, because you don't want it to ruin their esophagus, but number two, because you want them living the best life they can possibly live. So it is a guessing game with dogs. There's
it
no
really
doubt
is.
about it. And
It really is because
knowledge is key.
people think, well, my dog loves his food. I couldn't possibly do that. That would be the last straw. But people that actually go that route, and we have tube feeders in our group that have been feeding their dogs for years like that.
Mhm.
And the dogs are normal, healthy dogs, and they're more healthy actually. So,
Being
um,
fed by the tube, they're healthier.
but,
And
right,
you have that information on your website. I
sure
saw that.
do. Yeah, I
Yeah.
sure do.
You also have, which I absolutely love, a cookbook and recipes.
Hmm.
So,
Yeah,
yeah,
that's
I think
yeah,
that's
that
fantastic.
we've had a lot of help. One of our great members, she actually does the website for us, and she also designed that cookbook. And she's just so talented, very very talented, and I just appreciate her so much.
Can you
So
tell us more about that? Can you tell us more about, the Upright Canine Brigade, the organization and the people yourself and the people that help you run it?
sure, I can. Yeah. So we started in 2012. I just my dog had myasthenia gravis, and I thought at one point he had Megaesophagus. So I joined the group. It was actually a friend of my daughter's that said, "Hey, Barb has a dog that has the same thing." And we were like, we got together, and she goes, "No way," And she says, "Here, you need to join this group." So I joined the group, and about 2 weeks later, I found out he didn't have Megaesophagus with his myasthenia gravis, which is about 10% of dogs don't, and he didn't. So I was very fortunate, but I couldn't break away from the group. It was called Canine Megaesophagus Support Group then, and it was run by a nice couple up in Canada, and I, it was just like every other post, the people were, so discouraged with their vets, and nobody knew how to treat it. And, and the dogs were dying because they weren't getting the diagnosis early enough, because they were going down the wrong path. They were going down it's the food they eat, or, it's exploratory surgeries and all this stuff. And just to find out they just needed to look at the esophagus. So a group of us decided that we needed to start an awareness group, to really get out there with the public and talk to vets about Megaesophagus. And so it was just a grassroots thing. I posted, "I'm mad as hell and I can't take it anymore." And then from that post, we just brainstormed and came up with a name, and then about a half a year later, we put up the Facebook group, and we started going out to pet events. And then in 2015, that was a big year. We went to our first ACVIM, which is it's the American College of Veterinary Medicine in Indianapolis, and we exhibited there, and we made June the Canine Megaesophagus Awareness Month.
Good to know.
Yeah.
Good to know. I'm gonna highlight that on my notes.
Yeah. We became a 501c3. We put the website up, and then it just blossomed from there. From a mere 50 members to now we're over 14,000 members, and growing all the time. And we started called the UCB Buffy Project after the first dog that we all helped, and in 2017. And we is an assistance program for rescues and shelters with Megaesophagus animals. So what we can do is purchase the Bailey chair for them, or the neck hug, or inflatable e-collar, because they need that at night to keep their head up, so they don't, choke on their saliva. So they need to keep that head elevated.
Right. So the collar is not, it's not the plastic cone collar. It's like a donut. It's like kind of what you wear on an airplane to keep your head up.
Correct. Absolutely.
Yes.
And some people do use that too, as well,
Yeah.
And we also help with medical bills, like when these dogs have to get that PRAA surgery. We can assist them with that. We've been giving out $1,000. We've been able to give each rescue that goes through that surgery. And it does help, I think, a little bit. I mean, it's running between $4,000 to $6,000, sometimes less, but it's running between $4,000 and $6,000. Wow. So, so we do a lot of fundraisers. Yeah, we do a lot of fundraisers through the year. And it's been a wonderful thing. But the group is by far the best thing that we do.
The Facebook group?
Oh, yes. Okay. It's by far the best thing we do, because it's just, we all learn together, we all laugh together, we all cry together. Sure. And we support each other, right. And everybody gets in there and jumps in and helps. And it's just great. Everybody will say, "Well, I've tried this and it works for my dog." And then somebody else will say the same thing. They tried something else. It's amazing, and it's just full of love and support and kindness. And that's what made me fall in love with the people that have these dogs. They're
Mhm.
special people. And, they just
Well,
want to do
they're going
everything
through
they can.
quite an ordeal. I mean, I'm gonna say quite an ordeal because it just sounds like such a challenge and doesn't sound like, um it sounds like you would need a lot of support to to, um, to spearhead Megaesophagus head on.
Right.
So yeah, I feel the same way about degenerative myelopathy in our support group. You really do need to rely and lean on like-minded folks who are going through the same thing as you are. You know what? You think you have it all figured out in your head, and then you find out somebody else has got it figured out better. And what better way to find out than on a Facebook group that's
Right, right,
specific
right.
for that what's going on. So, Donna, can you tell us where people can find out more about Megaesophagus and the Upright Canine Brigade?
Yeah. So we have a great website. It's called caninemegaesophagusinfo.com. It's a big long word, but if you type in Upright Canine Brigade in Google, it'll come up. So that's a lot easier. Just type in Upright Canine Brigade and Canine Megaesophagus info will come right up. And so you can find us there, and we're also on Facebook under the same name, Upright Canine Brigade, uh, Awareness and Support. And we're also on Twitter, Upright Canine at Upright Canine BR, because I couldn't get it all in.
Like,
and and then Instagram, we're on Instagram as well as Upright Canine Brigade. So it's been quite a journey. Quite a
okay.
journey.
I will be sure to include all of that information. So you have a TikTok and a YouTube too, but I will be
Yeah.
sure to include all of that information in the show notes. That way, when people read the blog post and the podcast for this episode, because there's going to be a blog post as well, all of your information is going to be included in there with clickable links that will just drive them directly to your platforms.
Oh,
So,
that's great. That's
yeah.
great. Yeah.
Well, I mean, hey, listen, um, you had indicated here that I asked you how many German shepherds that you come across, and you said a good amount. So, whether it's a German shepherd or whether it's a lab or, golden doodle or whatever, I feel it's imperative that we all work together because we all love our dogs. We
That's
all
right.
love our dogs and we all want what's best for them. And there's nothing scarier than being presented with an issue with your dog and not knowing how to fix it
Exactly. Yep.
or where to get the information. You don't even have to know how to fix it. You just have to know where to look to find the information that you need. So this is how I'm trying to spearhead that is by getting this information out.
Well, you're wonderful, and I really do appreciate this. I mean, it's just, we've all of us in the group have been at the same spot at the same time where we went, what is that? What? I
Yeah.
remember I came back from my first when my dog was diagnosed at UPenn, and I came back and I thought she said DM. I thought
Mhm.
that's what he had, and I was like go googling down the wrong track and everything else, and then
Mhm.
I realized, oh well, the myasthenia gravis, and then I was like, and there wasn't much on the website,
Mhm.
on the web, on that or Megaesophagus. And then I read about Megaesophagus and I was like, oh no, I hope he doesn't get that. And, so everybody's been at the same spot.
Right.
It's, but we know that there's hope, and there's can be very good outcomes with both those diseases. So
Well, that's fantastic. And you know what? Fingers crossed at some point, just like DM, they find out what the heck is going on and they're able to just take care of it. So
right,
it doesn't,
right,
continue to keep making poor dogs' lives miserable because I can't imagine them. You know what? I was going to say I can't imagine them feeling any other way, but really these dogs, they're just so stoic,
they
aren't they?
are,
They're
they
just so
are.
stoic and they just seem to take it in stride for the most.
Yeah,
And
yeah.
I think we could all learn something from dogs and how they deal with the cards they're dealt. Because they
That is a very good point. That is a very good point,
yeah, because
because like, everybody will say if they have an older dog and they'll say, "Oh, I'll never get my dog to do that." And then once they see the food and they figure it out, they hop right in the chair.
I'm going to watch these videos because I
Oh,
want to
yeah.
see all that you're talking about here. But Donna, I wanted to thank you so much for being on here and spreading the word about Megaesophagus. I'm truly, truly grateful that you were here, and I'm so excited to get this information out to the people that follow along on our social media and website. Really, I am. I can't see this being anything other than beneficial. So thank you so much for taking the time to be with us.
Thank you for having us. Really, really, I really appreciate it.
Okay. All
Okay.
right. You take care.
You too.
Thank you.